Hello everyone. My name is Rakatare. I hold an MPhil in clinical psychology and I am passionate about combining psychology, artificial intelligence, and education to create a positive impact. My long term vision is to become a leading AI enabled clinical psychologist, build a strong professional personal brand, and continuously improve my communication and leadership skills.
Mm.
I would like you to act as my mentor, coach, and learning partner. Please provide practical guidance, constructive feedback, and actionable advice to help me achieve my goals. Welcome,
Absolutely.
ChatGPT.
One sec. For COVID workup, the exact steps depend on whether someone's being diagnosed or evaluated for severity. Usually, the basics include a history, symptom check, vitals, and possibly a PCR test or rapid antigen test first. If symptoms are moderate or severe, labs like CBC, CRP, maybe D dimer can be ordered, and imaging like chest x ray only if pneumonia or complications are suspected. If you want, tell me whether you're studying for an exam or dealing with a real patient scenario.
ChatGPT, how can I become a highly respected clinical psychologist in the AI era?
Checking that. Given your background, I'd aim for four long term goals. First, deepen clinical expertise. Just become excellent in evidence based therapies. Keep up supervision and training. Second, become AI literate. Understand what the tools can and can't do. So use it to support assessment, documentation, or psychoeducation, not replace human judgment. Third, build a trusted professional brand. Share clear, accurate content on LinkedIn, YouTube, or Facebook. And maybe start speaking at webinars. And then, fourth, develop leadership and research skills. Collaborate on projects, publish articles, maybe, mentor students. And as a little bonus, set a 5-year roadmap. Year one, strengthen clinical skills, plus basics of AI. Years two and three, certifications, start public speaking. Years four and five, open a clinic or consultancy, publish or write something like a book, and maybe teach or train other professionals. Yes. For our daily work here, we could pick one case study to dissect each day, or review one new psychology or AI paper. Does that match what you had in mind?
ChatGPT, how can I use AI ethically in psychological counseling and mental health education?
Right. Checking. AI can be a useful assistant.
ChatGPT, how can I use AI ethically in psychological counseling and mental health education?
One sec. 5 principles can help. First, protect client privacy. Don't put identifiable data into public AI tools. Second, you stay in charge. Use AI for, say, research summaries or drafting handouts, but not for diagnosis or high stakes decisions. Third, be transparent. Tell clients when AI assists your work. Fourth, check evidence. AI can sound convincing but be wrong. Always verify with clinical guidelines. And fifth, watch for bias. AI can reflect skewed data, so adapt it thoughtfully. Use AI to create psychoeducation materials, simplify complex concepts, outline workshops, or practice mock counseling scenarios. Just don't diagnose, replace therapy, or make suicide risk calls without thorough clinical evaluation. Basically, if you'd be comfortable explaining your process to your supervisor or licensing board, you're much more likely to be using AI ethically.
What are the most common mental health challenges people face today, and how can psychologists help?
Checking. Today, common challenges include anxiety, depression, stress, burnout, trauma, substance misuse, relationship issues, and loneliness. Psychologists help by doing thorough assessments, offering evidence based therapies like CBT or ACT, and teaching coping skills. They also do prevention work in schools and workplaces and collaborate with other healthcare professionals. In the AI era, they can responsibly use tech to personalize education materials or track symptom patterns, but not replace the human therapeutic relationship. The heart of effective care remains solid evidence plus genuine human connection.
How can I improve my critical thinking and decision making as a psychologist?
Checking. It's the craft you build. Start with then practice lies. Be aware of confirmation bias and actively challenge your assumptions. Seek feedback. Talk complex cases through with supervisors and reflect after each session. What worked? What didn't? What would you try next time? Add AI as a thought partner, ask it to summarize research, generate alternative hypotheses, then compare against established evidence. Try daily 20-minute deep dives on one case or ethical dilemma. Write down three takeaways and one action. Small, consistent habits make better judgment second nature.
Okay. ChatGPT, what AI tools should every psychologist and educator learn to use?
Checking. For your goals, think in categories. For research and learning, try ChatGPT, Google Gemini, and Claude. For lit searches, Google Scholar, PubMed, Semantic Scholar. For content and education, Canva with AI features, Gamma for slide decks, CapCut or Descript for video or podcast edits. For writing and productivity, Notion AI or Microsoft Copilot, plus Grammarly for clarity. For data analysis, learn SPSS if you do quant research, and basic R or Python if you move into larger data sets. And for ethics and privacy training, learn AI bias basics and confidentiality do's and don'ts. Pick a few per category, not everything. Build 1 year plan. First 3 months, master ChatGPT, Scholar, PubMed, and Canva. Then, months 4 to 6, add Claude, Gemini, Notion AI, and Grammarly. Months 7 to 9, study prompt engineering, AI ethics, and basic SPSS. Months 10 to 12, build a portfolio, publish educational content, create workshops, and complete a small research or AI and mental health project. That blend makes you both effective and professional.
Okay, ChatGPT, teach me one practical AI concept today and show me how to apply it.
Checking. Prompt engineering. That is asking AI clear, structured questions to get useful answers. Use the RTCF framework. That's role, task, context, and format. For example, instead of saying explain anxiety, say act as a clinical psychologist. Explain generalized anxiety disorder to a 20-year-old university student. Include symptoms, causes, three coping strategies, and when to seek help. Formatted with headings and bullet points. That simple structure yields far better results. Try drafting one yourself using RTCF. Send it over and I'll help you refine it.
Okay, how can I use ChatGPT to increase my productivity at work?
Checking. You can use it as a daily productivity partner. Plan your day, create lesson plans or workshop slides fast, summarize research journals, refine emails or social posts, brainstorm teaching activities, and learn one new psychology or AI concept a day. Make a repeating prompt like act as my productivity coach. Prioritize today's tasks and suggest one AI use I can apply ethically. Adjust each morning. And remember, never paste identifiable client info. Keep it educational and ethical.
Okay, what AI trends will shape healthcare, education, and psychology in the future?
Checking. Over the next 5 to 10 years, AI may shift from replacement to collaboration. In healthcare, AI assisted diagnosis, personalized treatment support, and remote patient monitoring will grow, but clinicians will still lead decisions. In education, more personalized learning, AI tutors, and automated grading, while teachers focus on mentoring. In psychology, AI tools may help with admin work, research summaries, and educational content, but empathy, diagnosis, and therapy stay human centered. The big trend ethical AI literacy. Professionals who pair strong clinical skills with careful AI use will have the biggest impact.
Okay, how can I write better prompts to get more accurate and useful AI responses?
1 sec. Use the RTCF framework. That's role, task, context, and format. Add audience and length. For example, act as a clinical psychologist. Explain stress to university students with causes, symptoms, 5 coping strategies, and a what table. Ask for evidence based info. Set constraints like under 300 words, and ask one clarifying question if unsure. Treat it as a conversation. Refine iteratively. Try, review, tweak, repeat. That steady refinement will noticeably boost accuracy.
Okay, my next question is how can I improve my English speaking and public speaking skills?
Checking. Practice daily. Speak on one topic for 15 minutes, record, note one fix. Read articles aloud 10 minutes daily. For public speaking, use a clear structure. Hook, 3 points, takeaway. Learn 5 new words a day. Practice short speeches and get feedback. You can ask ChatGPT for mock interviews, conference Q&A simulations, or grammar corrections. Try a 30-minute daily routine. Say 10 minutes, read an English article aloud, 10 minutes, short speech on AI or psychology while recording, 10 minutes, review and refine. Do that consistently for a few months, and you'll notice real confidence and fluency gains.
Okay, what qualities make an effective leader and how can I develop them?
Check it. Strong leaders communicate clearly, show emotional intelligence, make evidence based decisions, act with integrity, stay resilient, and invest in others. Practice weekly. Read a chapter on leadership or psychology. Hone one communication skill like active listening. Reflect on one leadership decision you made and ask for feedback from a mentor. Use AI to prep presentations or simulate tough conversations. Then apply those lessons in real interactions. Each day, ask, did I help someone learn or grow today? That habit builds leadership.
Okay, ChatGPT, my next question is how can I build a strong personal brand as a psychologist and AI enthusiast?
Checking. Start with a clear message. Position yourself at the intersection of clinical psychology, AI, and mental health education. Define your niche in one sentence and use it consistently on LinkedIn, Facebook, and other platforms. Share practical mental health tips, explain psychology ideas simply, post ethical AI insights, and show your professional growth. Build credibility by attending workshops, getting certifications, contributing to research, and speaking on panels. Find your voice. Clear, evidence based, approachable. People trust consistency more than trying to go viral. Each week,
Okay.
post two educational pieces. Engage thoughtfully with other professionals' content and reflect on what your audience is actually asking. Trust builds slowly, but lasts a long time.
Okay. Suggest one LinkedIn, Facebook, or YouTube content idea I can create today.
Checking. Idea: post a short LinkedIn or Facebook titled Five Ethical Ways AI Can Help Mental Health Professionals Without Replacing Human Care. Start with a hook, give five practical uses, and with a call for thoughtful discussion. It fits your niche, sparks engagement, and builds credibility.
Okay, thank you for today's guidance and support. Before we finish, please summarize the key lesson I learned today. Identify one area where I can improve, and give me three actionable tasks to complete before our next session. I look forward to continuing my learning journey with you tomorrow.
Checking. Today, you learned that AI works best as an assistant, not a replacement. And the big opportunity is consistent daily practice. Area to improve: apply these skills more consistently. Three tasks. One, write one LinkedIn or Facebook post on five ethical ways AI can help mental health professionals without replacing human care. Two, practice prompt engineering by drafting three structured prompts using RTCF on stress or anxiety. Three, record a 3-minute English presentation introducing yourself and your mission. Tomorrow, we can practice mock interviews or work on public speaking feedback. Keep the momentum going. You're doing great work.
Okay, thank you so much for joining us today. See you in the next session.